Everybody's sort of doing fantastic science-based, evidence-based work, but the data is not captured. You work as a good clinical team, but the nursing work in silos.
Today in this episode, I have a privilege of being joined by a leader. I have with me Dr. Sanjeev Singh, Medical Director at 𝗙𝗲𝗁 Institute of Medical Sciences.
This Shiksha Guru of mine told me that you need to meet Mata Amritanandini at some point of time. Met her, she hugged, and that melting happened. The trust between the government and the public that both of us can only make the difference is extremely important.
A myth about hospital management that you'd like to bust.
That everybody can do.
Hello everyone and welcome to this episode of The Bold Voices, a one-of-a-kind initiative where we have tried to bring together the real and remarkable conversations from one of the boldest minds in the healthcare industry. A Voice of Healthcare and Polymed's initiative. We've just intended to bring together the change makers who are silently but resiliently changing the navigation of how the Indian healthcare industry looks today. Today in this episode, I have a privilege of being joined by a leader whose work in healthcare quality, patient safety, and to be specific, infection control has been exemplary since last few years. And recognized globally, I have with me Dr. Sanjeev Singh, Medical Director at 𝗙𝗲𝗁 Institute of Medical Sciences. From shaping a large-scale hospital system to influencing national policy and patient safety, Sir has been at the forefront of a patient-centered care and hospital excellence. Together, what we are planning to do today is to dive into hearing his journey, the principles that has been guiding him since decades, guiding his leadership, and the bold steps required today to build a resilient healthcare ecosystem in India. Now, before we dive into the questions, it's a privilege, sir, to have you to this discussion today.
Thank you so much for having me here, and congratulations for starting this fantastic, innovative initiative.
Pleasure all ours, sir. So, as I said, to hear everything that has motivated you to the situation that we're sitting here today. But then just allow me to take a step back towards building 𝗚mrita Hospital what it is today. Before Dr. Singh was into the world of medicine, may I just ask you to just probably into your younger years, what led you to empower yourself and enter into the world of medicine?
Very different question. Nobody has asked this before. So I need to reflect. Basically, I think we were a decent student, too much into basketball and sports, and had not planned anything major for the life, but very, very good friends. So it was very hunky-dory. Somehow I had a cousin in the medical school, and before she was leaving for greener pasture, she introduced to me to one of her very brilliant minds as a senior in our medical college. And then he was partly serving, giving a free service. He was a gold medalist and was part of internal medicine faculty, also giving service at a 𝗏𝗏 Mission Hospital. And then my cousin introduced me to this gentleman, and I very reluctantly used to go and meet him because I would like to play basketball rather than going to 𝗏𝗏 Mission Hospital and serve. But somehow after meeting him, something changed. I used to sit with him. I used to look at all the poor patients used to come. I used to then go and look for charity, look for drugs, look for investigations, do some bit of what now very glamorously is called as crowdfunding. And then got into this whole work of medicine, which was not too exciting at that point of time. And I was very close to my mother. Unfortunately, she died very early. And we, as a good, obedient son, wanted to just follow what she wants me to be sort of doing. And she wanted me to take medicine. And as the things are, and being an obedient son, I just dived into it and did medicine. I did my post-graduation in pediatrics and was just sort of doing my senior residency. Post that, I got an opportunity to work in World Health Organization in a disease eradication program. And that was, again, a very good project, superb learning. with some international stint. And very interestingly, this Siksha Guru of mine told me that you need to meet Mata Amritanandmayi at some point of time. If you get a chance, do meet. And she was in Delhi. I was doing my vacation, summer vacations, and I saw a board, Amma in Delhi. And just like a fashion, I sort of stood in the queue. While I was waiting there for 3 to 4 years, I was really very annoyed because it was a long wait. But then when we met her, she hugged, and that melting happened. And then she said that there is a nice institution which she has built, and I need to work there. And I was there with my wife, who's a professor of anesthesia, and I was telling her that we should not come and meet these people because they're hypnotists. And but then she asked her to sit beside her, and she was so simple, so beautiful, so engrossing, that she was listening to everybody's pain, that it was very moving. And some magic started happening. We have no clue what. And my son was 8 months old, and then we packed our bags and went to Cochin. And it's been close to 24 years that I've been with them. So no planning. It's just following whatever is destined, and extremely, extremely grateful to God for all what has been given, and to have a very fantastic association with Mata Amritanandmayi to keep us grounded, and yet doing some good work and giving back to the community.
May I add exemplary work, sir, not just good work. I mean, you very humbly shared the story of a mother who just maybe manifested that a child may enter to the world of medicine. Little did she knew that, this would be the day where you've led and such exemplary led the Amrita Institute where it is today, sir. So many, many congratulations on that.
Thank you so much. But I feel bad that she's not there. I just wanted to quote one thing, if I'm
Sure.
allowed.
Mm.
This power of now is very important, because when we opened this particular institute, um, this was, we have worked hard, and the journey was from Kochi. We were coming to one of the largest private hospital in the country. There was an inauguration which was happening. Mata Amritanandmayi never visits any of their institutions because she's a spiritual and a divine figure. But then she was here for the inauguration. Prime Minister Modi, whom we just love, the kind of work and kind of sacrifice and nationalist is. So he was there. All best of your group, the direct disciple of Amma, whom you sort of do satsang, they were there. So your Sadguru is there. Prime Minister Modi, a fantastic statesman, is there. Direct disciples whom you want to just listen are there. But who's not there was my mother at that point of time, because he passed away. My father, he had very long-term Alzheimer's and just didn't recognize me, and then he passed away. My wife, who has been suffering for a very, very long time, and she was not there. My son, who was doing his master's. So it is so very important that the power of now, that we somehow try to build something for the future, but it is so important that the present is so important. Your best of people was there, but my family was not there. But it was a very cherishable inauguration for this particular institute.
Having all those footsteps here during the inauguration, sir, I think it's very important for an institution who's medically treating and just, is engrossed so much in treating people at the right time and the right set, including patient safety. So yeah, I mean that. Once again, congratulations on the
Thank
stint.
you so much.
While we have taken a backseat and tried to understand Sir's journey till the day today we are here, Sir emphasized on now. So let's take to the present. Now where we're here, now where are we in the institution of Amrita Hospital? We know that it has turned into a global model, not just for patient safety and for quality standards, but also some of the examples and turning points that this institution has led to, where patient safety now is a synonym, sir. So for many institutions that are also growing, some tier 2, tier 3 cities as well. So may I ask some of the key turning points and challenges that you faced during the transformation where to the institution that is today?
Yeah, very good question. I was very fortunate within this institution to be working with very nice souls, and they were great professionals. You soon see that change, you want to change, but the acceptance to change is not there. Somehow it becomes very, very challenging because they are all set into a routine work, and anything new is difficult to accept. And everybody sort of are doing fantastic science-based, evidence-based work, but the data is not captured to be able to show that yes, there is a good key performance indicators and you're showing that as a good outcome. Everybody in their own field are doing fantastic work, but the team doesn't exist. So it's all about individual work, and then they know the best, but as you get into the team, it doesn't work. So you work as a good clinical team, but the nursing work in silos. So there are lots of work, good work which is happening, but it happens in silos, and getting all of them together, that whole puzzle, putting it together, and then demonstrating, collecting data and demonstrating that it has an impact and you're improving outcomes. You're reducing cost, you're reducing mortality, you're reducing morbidity, you're reducing cost of care, and ultimately the patients are getting satisfied. So it is about bringing in very, very innovative practices, looking at patient related outcome monitoring, patient related experience measures, which was not getting measured. There are Institute of Healthcare Improvement triggers which are there, and it is important to look at those clinical triggers and watch your own practice. So I think it is a fantastic, meaningful journey, a lot of hard work, getting everything together. Huge challenges because the acceptance towards quality and patient safety still is not there, and somehow the clinical team's participation needs to be at the forefront, because if they become role models, the acceptance with the remaining team is almost is very evident.
So you did mention about how I'd say segments of care delivery are working in excellence, but then in silos. There has to be, or probably there is now an understanding amongst all the healthcare delivery providers that this specific is a need to, come together, converge, and then uh, just for a common goal of a better healthcare delivery. But then I also think that, I mean, you mentioned about how nurses are working beautifully, but then in silos, and then the providers are working beautifully, but then in silos. I also think that's the different segments of industry, care providers, diagnostics, medical devices. Again, as well, the silos remains constant. There is a need to bring, probably by either forums or discussions, but then collaboration, I think, is the need of the hour. And it's just not towards the institution, but I think is also towards the overall healthcare parameters and deliveries. So, and also, so you mentioned that, uh, so you've had an instrumental role while you said that you've been with NABH since the NABH started. You know how the standardization and SOPs work, sir. But then, as somebody who's deeply involved also in advisory roles, also in leadership, and also towards policy making, or I'd rather coin it as policy shaping of the healthcare industry, are there any core principles that you've led very constant towards yourself, whatever so many decades of experiences that you have, the core principles that you believe are the key to your leadership?
I think getting the team together is very important. So I'll give you an example. There was a And be ready to listen is very critical. So we thought that we are a fantastic institution and we do good work. And there was this lady who's a nurse from a critical care, 𝗙𝗍𝗻𝗂 from University of Minnesota, who visits us and tears us apart. She tells us that our practices are way beyond what is benchmarked. And it was very interesting to just learn that what we thought is a fantastic institution, but we are not at all delivering what is. And that is where my interest towards infection prevention and antimicrobial resistance also got initiated. And she brought in the concept of surveillance, that there are international definitions and you need to sort of comply to those definitions. There are numerators and denominators you capture. And then there's a way to prevent it also. It's not about looking at infections only. There are bundle care approach where you need to prevent. And it was a very exciting journey. And fortunately, again, grateful to Amma and grateful to God to have met her. And she basically introduced us to a very international standard way of practicing. And we did well. We also built our own capacity. We started our infection training program for nursing, for the fellowships for doctors, because we realized 2005, 9, those gaps were there within the country, and we need to sort of fill in those gaps, because you can be a good institution, but it is good also to allow people or handhold people to sort of also grow. When we looked at our antibiograms, and we were seeing that rational use of antimicrobials was not happening, and when we looked at our own policy, you realize that your tertiary care patients are multiple hospitalizations do happen. They are already pumped in with antibiotics, and when they come to the tertiary care, when you take cultures, there is no growth, but then they are sick, and then your the whole band of magic bullets, which are antibiotics, uh, there's nothing left. And it kept wondering that how it's going to improve. So 2011, I went up to the government of Kerala, and it was a very challenging journey. Some good points, many bad points. That everybody in the society needs to improve with the rational practice, and then only the tertiary care patients who come in will have some choice. Otherwise, if you keep doing it, nobody now is manufacturing new antibiotics, because it is not good business. The resistance pattern emerges very soon. And we met with the health secretary. He called the teams of principals of the public hospitals. They all said that, why are we talking about this? Because everything what we do is good. And it just died down. But what is also important, as you was asking about those traits, is perseverance. Because if you just want to send a mail from top, if you just want to send a message from a top, nothing will happen. And this age where you need to sort of communicate well and be patient and take the team together and be very, very perseverance in your approach, you have to believe in yourself. This journey of almost 10 years, within my institution, people were always very critical that why am I wasting my time? And then we got all the professional societies, 18 professional sort of societies together. We built a good clinical guidelines that got released by the health minister. We didn't stop there. We started building a strategic action plan for containment of antimicrobial resistance. That was one of the first state to have a strategic action plan. That also got released by WHO and the state, the chief minister. And it didn't stop there, because you now have the document, you have a plan. What do you do? So all the hospitals got together, and I was the technical advisor for AMR to the state of Kerala at that point of time. We got the hospitals together that let's collect data and demonstrate that there is actionable difference which can be done. So plus then communicate to the community that you should not take unnecessarily antibiotic. If you are falling sick, please adhere to the doctor's advice. So there's a lot of this work, school health did happen. So what is most critical is perseverance. You have to believe in yourself. You have to be selfless. There's no selfishness which is going to take you for a long journey where you can sort of make a difference. You have to build team. So it was just not me, few people. The whole professional societies, they all sort of came together and said that, yes, there is a cause and we need to work on this cause. If you look back now, we work with the 7 states on a similar strategic action plan. And there is a decent work which is happening, which is very meaningful, very fulfilling at the end of the day.
So may I ask, I mean, you've played a decent role in convincing the policymakers, I might coin, and the common public. Which part of convincing is even more difficult? Convincing the people on the table or convincing the people, the public?
Very difficult question.
I know. I mean, that's
It all depends on how are you communicating. Because as a private institution, you, as a private body, you always realize that the government is not working and they don't listen to you. But when you look at their work, they are busy with their action plans. So they would be busy with their national health mission. They'll be busy with the vaccinations, diarrhea, vomiting, ARIs, the national communication. You think they are not working, but there is lot of work which is happening. Now, if you look from the government side, they think that private hospital is there only to mint money and there is no other agenda. And when you, right now, if 69-70% of the healthcare is delivered, which is fantastically delivered with so much of evidence, science, talent, such a skilled and competent people are available who are doing such good work, which is not known. So the bridging of this is the most important thing. The trust between the government and the public, that both of us can only make the difference, is extremely important. Community is, when they fall ill, unfortunately, they come to hospitals in Indian setting. So they otherwise, as a preventive step, they don't recognize health as an important parameter at all. And when they seriously fall ill, they come. So definitely community is very important because government has large agenda. They are and they have their own style of working. So at times it is difficult, but first of all, you need to convince yourself that this is the path which you need to take and this is going to be important, and you need to have time. You need to give yourself less and you need to sacrifice to be able to sort of make some good difference whenever it comes as a policy.
Right, sir. Now, you did share some of the examples here about how some examples and some instances have now led your sort of focus on patient safety and infection control, AMR, etc. But now, it's safe to say that I know how Dr. Singh is now entered the world of medicine, how Amrita has been what it is, and how terms such as patient safety, infection control. Now, I knew that, Amrita is very particular about all of these protocols, sir, but now I know the reasons behind it. That's beautifully narrated by you, sir. Now, we are towards the end of the segment, but before I let you go, I do have a couple of more interesting questions. Moving on to a bold rapid fire, I might ask you a couple of questions where I just request you to have that one word or instinct that comes to your mind at the first. So my first question is, one public health innovation India urgently needs.
Prevention.
Book or a thinker who shaped your perspective? Now, I think I know this answer.
Yeah, so I'm not sure about the book and a thinker because it's the Sadhguru, Mata Amritanandmayi. It was so beautiful. Again, this institution would have costed close to 5,500, 6,000 crore. She can charter a plane and come because this is one of those multiple institutions. With 1,000 devotees, she took a bus and traveled with them from Kollam to Faridabad 5 days. Simplicity at its best. And that should be the core, because we are unfortunately spending a lot of time and energy and money in something else. And she went back the same way, 5 days by bus on road with the devotees. So just looking at her, and we are trying. We don't say that we are anywhere close, but she has really changed many of our my perspectives.
One hospital ritual that you never miss.
So going on rounds every day and meeting with the clinicians, meeting with the nursing there at their area, at their geography, meeting with the technical team, understanding their issues at their location is what I think is extremely critical.
One bold decision that changed your path.
Many. But I think it is important that taking a shifting from clinical practice to hospital management, and that was again guided by our Sadhguru. I think that was a decent decision. I'm not sure whether it was bold, to be having changed that path. And then again, looking at infection prevention and antimicrobial resistance because of that nurse who visited and said that a lot of things to be done.
Talking about healthcare management, a myth about hospital management that you'd like to bust.
That everybody can do.
One quote or motto that you live by.
Change and innovation has to sort of always be there. And so that is in healthcare right now is very critical. Unfortunately, in an Indian healthcare is very copycat. So X hospital has done it, so Y is also doing it. I think we have to grow out of it and start thinking differently and see how best you can make the difference. And in India, we have amazing talent, very good skills, very competent people. And every hospital is doing fantastic work.
That's absolutely beautiful. So now, I mean, I don't have some more rapid fire questions, but just one more question before we close this discussion. Now, I'm sure, sir, this discussion would be seen and viewed by a lot of young aspirational, I'd say, doctors or healthcare administrators who just want to venture and with an intention to bring a systemic impact. Will there be one particular message or an advice that you'd like to give to the younger generation who are just trying their stint towards healthcare delivery?
I'm not sure whether there is one. There needs to be a resilience in your approach because you cannot be dogmatic that this is how it works. So you need to sort of keep trying and reflect on the practices and sort of listen to everybody because most of our good work or the ideas come from the nursing and you need to be open. So resilience is very critical. Humility is very important. Unfortunately, as you grow and you get your the area of power you sort of grab with the chair, you lose the humility and the humbleness to be sort of listening to everybody, to take everybody together, to also ask sorry when you have done a mistake, and to also be part of all the team when the goings are not too great. And it is important to communicate properly because you would have everything in set up in your mind, the vision, the strategy, the management principles. But you need to speak different languages to the clinician. You need to speak different language to the nursing. You need to speak different language to the technical team. You need to speak different language to my board. So that skill to communicate appropriately with the appropriate stakeholder is also very critical. So I would say resilience, humility, and communicating the shared vision would be a very essential ingredient. So youngsters should sort of strive for that.
Well, thank you, sir. Thank you so much for this inspiring conversation. I'm sure the people who are listening to us and might have been moved by so many anecdotes and stories that you shared. It has been very moving for me personally. So thank you so much, sir, for this very amazing conversation. To all the people who are listening to us, we just hope that the way we are bringing these conversations to you, it inspires you in a way that you also bring an impact to the healthcare delivery the way we are trying to make. Thank you so much, sir, once again. It has
Thank you
been lovely.
so much. It was a real pleasure and an honor to be participating in this.
Thank you. Thank you, sir.